1039 WDKX, the Wake Up Club. It is the Wednesday morning house call being brought to you by Jordan Health. Dr. Janice Harbin joins us now. Good morning, Doc. How are you feeling?
Good morning. I am well. Matter of fact, I'm 2 weeks after my second vaccine, so I'm doing wonderful.
You know, it's so interesting to hear that you're doing well. My mother got her first shot over the weekend down in New York City. Says that she's, of course, I'm calling in every day afterwards, making sure she's feeling well. They timed out now. I think she's getting the second shot before the end of this month going forward. And I know it's been a busy time for Jordan Health, too. It's been about 2 months since this vaccine effort has been going on.
It has been 2 months, and we recently was reached out by the governor's office to make sure that the inner city, the urban core, is receiving vaccines, and wanted to know how Jordan could do more than what we're doing as we look at expanding our clinic, our COVID vaccine clinic, to make sure that we are touching as many lives as possible.
I got to ask Dr. Harbin, you've been busy. Like, normally we have you in. I know you said something off air that I thought was interesting. You had a patient, and that's why normally we'll have you like 10 minutes earlier, but you were in the middle of taking care of somebody. So we definitely appreciate the time you have this morning.
Yeah, my apologies about being late, but as I was explaining, at Jordan Health, patient is always first. And so I was in with one of my patients and was able to step away now to make sure that I talk to the community that we love and that has supported us over these many, many years.
I got a friend of mine. She got a second shot and has not been feeling well. Is that some of the concern and issue people are dealing with the second shot from the COVID vaccine?
Well, yeah, what we're hearing, my second shot, I did really well. I think my arm felt like a flu shot that I normally would get, where the arm felt a little achy. But we have heard that for about 24 hours, people have kind of a flu-like symptoms, chills, maybe a slight fever, a little don't feel well, but it normally passes within 24 hours.
And I also know that the big issue now has to do with health care. Cuomo has the budget thing going on. I know you mentioned it a little bit earlier. What are some of the concerns you have here? Because this would affect Jordan Health and healthcare centers just like yours.
It will affect Jordan Health and millions of people that are served in community health centers like Jordan across New York State. Right now in the budget, the governor wants to carve out what we call 340B. And 340B is a federal program where Jordan Health is able to go and buy pharmaceuticals. So the medications our patient needs, we buy directly from the pharmaceutical companies. We send it to the pharmacies or have it delivered to the pharmacies, so that if you show up with a Jordan Health prescription, you're guaranteed that you're going to get those prescriptions regardless of what it costs. And I think we shared before that our patients that have been treated with hepatitis C, those medications was costing around $90,000 for 3 months to treat a person. And, I make a decent living. I couldn't pay $90,000 for 3 months. We were able to get those type of medications and get it to our patients to make sure our patients are now hepatitis C free. If the governor budget goes through and he carves out this 340B dollars, we're going to have to look at some of the services we provide that right now those dollars help support our healthcare workers and our social workers and our dietitians that we cannot bill for. And we may even have to look at some of our sites to say we no longer can afford to keep all of these sites open that has been serving the Rochester community. So we are encouraging that the community kind of understand how this will impact them directly, and make some calls to their representatives to say, now is not the time when you have centers like Jordan on the front line fighting with you against this virus. Now is not the time to now cut their legs from under them.
One of the things that people have to do is call Jordan Health. What is the number to call if they need health assistance or they want to help Jordan Health stay open?
I would say they need to call their representative. So whoever is representing you in the state house, your senators and your assemblymen, you need to call them directly and say, we want to support community health centers like Jordan, and say no to the governor's budget as far as this 340B carve out. Just say no. And it's in the legislator's hand.
1039 WDKX, the Wake Up Club, Jordan Health, always there in the community. Thank you, Dr. Harbin, for the time and information. Appreciate it.
Thank you, and thank you guys for all the wonderful work you do. Stay safe and stay well.